Hello, every committee. My name is Thanawan Panyamit. I'm from Stevihan School. So today, me and my members are going to present about identification of factors in the survival rate of heart failure patient by using machine learning models and principal component analysis. So first of all, we're going to discuss about the introduction, the objectives, the material and methods, result in discussion, and the conclusion. First and foremost, I know that many people in this place would be perplexed with the word heart failure. Hence, I would like to introduce what heart failure is. Heart failure or congestive heart failure is a life-threatening disease more than 64.3% inability of the heart muscle to pump blood and carry sufficient oxygen around the body efficiently, subsequently leading to reduced blood flow and cause shortness of breath. In addition, it may develop from coronary artery disease, high blood pressure, heart attack, high cholesterol, heart valve disease, or diabetes. This condition happens typically in older people since the main artery will become thicker, stiffer, and less flexible when we become more mature.
Generally, the survival rate for patients diagnosed with heart failure is marginally low. About 3/4 of people survive within 1 year, around 45.5% at 5 years, 24.5% at 10 years, and 12.7% at 15 years. Furthermore, women have more terrible short-term and long-term survival rates than men. Male sex, advanced age, history of diabetes, smoking, and chronic kidney disease are the crucial criteria that can increase the mortality rate. Furthermore, the medical practices for diagnosing heart failure include examining the sound of the heartbeat or lung congestion to diagnose any abnormality in the cardiac rhythm, and using physical examination like electrocardiogram or ECG, chest X-ray, magnetic resonance imaging or MRI, cardiac computerized tomography or CT scan, or coronary angiogram.
The open source data set from the UCRV machine learning repository has a database containing medical record information of 299 patients with heart failure, with 13 clinical features collected during their follow-up session. The patients consisted of 105 women and 194 men with the age interval 40 and 95 years old, having left ventricle systolic dysfunction classified as class 3 and 4 of New York Heart Association, or NYHA, and have ever had heart failures. Schickau and German reported the dataset and developed machine learning using the dataset. The model considered 13 clinical variables that can contribute to a fatality, which consisted of age, anemia, high blood pressure, creatinine phosphokinase, diabetes, ejection fraction, platelets, sex, serum creatinine level, serum sodium level, smoking, time, and death event. Besides, providing the graphical forecast of survival probability and a nomogram, the study has the potential to alter clinical practice by providing clinicians with a new tool for predicting whether or not a heart failure patient will survive. Indeed, when determining whether a patient will survive heart failure, clinicians may rely heavily on serum creatinine and ejection fraction.
The objectives. This research aims to identify crucial medical parameters that the doctor should pay attention to predict heart failure mortality, using machine learning to predict the survival rates affected by each factor compared to the findings reported in the literature, and apply principal component analysis or PCA and machine learning models to examine the factors influencing the accuracy of predicting disease rate of heart failure patients. Materials and methods. 1. Dataset and data curation. The heart failure dataset we analyzed in this study was obtained from the open source University of California Irvine machine learning repository, assessed on January 14, 2022. The original dataset contains 299 patients consisting of 203 survived patients and 96 dead patients. So this dataset is a biased dataset towards the survived patients. As mentioned earlier, the main objective of this study is to identify which factors affect the mortality rate of the patients. Therefore, we removed 107 survived patient information by a random selection to ensure that the dataset was unbiased. Totally, there were 192 entries, with 96 dead patients and 96 survived patients. This is the data before curation. As you can see, the dead and the survived patients are uneven and biased towards the survived patients. And the data after curation, now the dead and the survived patients' information are even and unbiased. Comparing data before and after curation, the mean and the standard deviation of all variables have changed. However, there are also some variables that the maximum and or the minimum doesn't change.
Machine learning models and training. The 13 variables were first treated as predictors and labeled. For supervised machine learning training for classification task, there were 12 predictors including age, anemia, creatine phosphokinase, diabetes, ejection fraction, high blood pressure, platelets, serum creatinine, serum sodium, sex, smoking, and time. Meanwhile, in this study, the mortality rate was employed as label, as shown in this figure. Here, a built-in machine learning application in MATLAB 2021b has been employed to train supervised machine learning models using the following models, as shown in this figure. The classification accuracy was calculated using 5-fold cross-validation. Principal component analysis. A built-in principal component analysis, or PCA, model with a statistical confidence of 95% in MATLAB was employed to identify which predictors contribute to the model classification accuracy. Here, we got the data set from an open source, but we saw that the data set was biased, so we make it into an unbiased data set. Then, we built up using 32 models and using 12 predictors, 1 predictor, 2 predictors, 3 predictors, and 4 predictors to see that it was enough to see which model has the highest accuracy and to find which variable leads to heart failure by using 5-fold cross-validation. The next section will be the result and discussion. What is the top 3 most accurate machine learning models using 12 predictors? The first one, the assembled baggage tree model with 94.8%. The second one, the coarse tree model with 94.3%. The third one, the fine tree model, the medium tree model, and the logistic regression model with an accuracy of 93.2%.
PCA using one variable. The top 3 most accurate machine learning models. The first one is the quadratic discriminant model and the Gaussian naive Bayes model with 52.6% accuracy, then followed by the coarse KNN model with 51.0%. And the third rank is the bilayered neural network model with 50.5% accuracy. The PCA indicated that the platelets were the most significant parameter. Nonetheless, the single variable was not sufficient to develop an accurate model.
PCA using 2 variables. The top 3 most accurate machine learning models. The first one, the wide neural network model, had 57.3%. The second one, the quadratic SVM model, the weighted KNN model, and the bilayered neural network model with 54.7%. The third one, the medium neural network model with an accuracy of 54.2%. Chico and German represented that serum creatinine and ejection fraction were the 2 most important parameters to identify the survival rates of patients with heart failure. However, according to the principal component analysis, or PCA, the parameters for 2 variables were platelets and creatine phosphokinase. Moreover, using only 2 parameters was insufficient to provide a good prediction. Therefore, in the next section, we will investigate with 3 parameters.
According to the table mentioned, the models developed using 3 predictors and the PCA with the highest accuracy to the lowest accuracy are listed in the picture. The ensemble budget tree model had 96.4% the highest accuracy. It lists that the coarse tree model with 95.3% accuracy. The fine tree model and the medium tree model with an accuracy of 94.8%. However, we have achieved the same level as 12 parameter when we use only 3 parameter. Therefore, using only 3 parameter was enough to identify the factor that contribute to the crucial parameter that contribute to the mortality of the patient.
1 minute left.
PCA using more than 3 variables. This section demonstrates that 3 variables are sufficient to build an accurate model. We computed the PCA responses for 4 to 12 predictors and showed only the highest accuracy model for each number of predictor in the table. The accuracy gradually increased from 1 variable to 2 variables, and then the accuracy increased dramatically at 3 variables. However, the trend became stable from 3 variables to 12 variables. Therefore, according to the table here, the 3 variables were enough to predict the mortality rate of the patients. At this figure, it shows the highest classification accuracy models for different parameters ranging from 1 to 12. It can be seen that 3 parameters, which are platelets, creatinine, phosphokinase, and time, are sufficient for developing a machine learning model.
Next, we're going to talk about conclusion. This research analyzed the classification accuracy and identifying the crucial factors contribute to the mortality of heart failure patient using a data set from UCI Machine Learning Repository website and machine learning models. We have applied the PCA and machine learning models implemented under MATLAB 2021 to compare the differences of statistical model in terms of the class validation, classification accuracy. Here, the machine learning models were developed to predict the age of patient mortality. Therefore, the date event was employed as a label in supervised machine learning. The PCA analyzed model developed using 1 to 12 parameter. We found that the 3 crucial parameters are 1, platelets, 2, creatinine phosphokinase, and 3, time, that doctors should mature and pay attention to first. Thank you.
Okay, time for questions. We have 5 minutes to answering questions. Okay. Please, Ajahn Thana, please.
Okay. A very common question in the machine learning field. So, do you think that with about 12 or 13 descriptors is 96 and 96 of sample size should be enough, ideally? Okay, so I know that there might be some limitation that you cannot get more data, but as you have seen in your model, do you think that you might need more data in the future to have your model to be more complete?
I think we need further data sets to say or to conclude that maybe like you say 96.4% it's not the highest accuracy, that it's for making sure that this 3 predictor it's going to be like the important factors. So we need further data sets. And for this research, we cannot like conclude it like 100%, or we cannot guarantee that this 3 parameters is going to be like the important factors that can contribute to the age of patient. This is because like at first we say that we use the data sets on the UCI and it is the biased one because like the number of people who be a heart failure, because like the number of people, the heart failure survival is greater than the deaths. So we need to randomize it again to make it unbiased and make it equal number between survivals and the deaths. And then we found that, oh, this 3 parameters is like be the priority one that doctors should mature and pay attention first. But however, we cannot guarantee 100% that the biased one or the non-biased one is more like is give us or it's yield the correct result. So we need further like data set.
I see. Very good, very good. So and also from the from 100, I think 107 that you have a cutoff to have the data to be balanced, right? And and have you tried more than one combinations of the selected 96? Is that survive data set? Have you tried any other combination? Like you said that you have randomized 96 from about 200 of those who survived, right? And have you also tried with other combinations?
Let me help them out a bit.
Okay.
Because like working behind their back to help supervising them on this project. Right. So because of the limit time that we had, so we had only one chance to try with one combination. Seriously. And yeah, that probably answer you. That is quite interesting though. We can have more data set by using some other combination, of course. Thank you for the suggestion.
Okay, thank you. Yeah, it's very interesting.
So any question?
And also, it might be good to have maybe descriptive statistics for the descriptives, because I think that maybe the age. I'm not, because I haven't seen the distribution of the age or of the smoking or of the other factors. So I'm not pretty sure if the age is how the age is distributed within the data set or the other factors. And it might also help us in deciding which also.
Interesting questions. Haha. And you're probably aware that they are high school students. They are actually M5. They hasn't done the knowledge of descriptive analysis yet.
Oh,
so that actually I mentioned that to them and they gone blank, seriously. Like, what I talked about at the time. So I think that is the best that they can deliver, but it's quite decent already, I believe.
But yeah, they're really good at this level, and yeah, very nice.
That's good to begin.
Very good English too. Much better than me also.
It's good to begin.
Okay.
And so I think that the time is already up right now. So thank you, presenters.